I was diagnosed with breast cancer on my left side in July 2017. There's no history of breast cancer in my family at all. It just came out of the blue. I'm like every other woman in the world. You always wonder, will it be me? And it was.
When I was diagnosed, it was August 2017, and I do have a very strong history of breast cancer in my family, so it's always been a concern of mine, so I always wanted to stay on top of my annual mammograms, and that's where it was discovered.
When you get diagnosed with cancer, everything is very quick. One minute you're doing the groceries, the next minute you've got breast implants in your hands and making decisions. When I came to see Dr. Roth, I had no idea about the options available. I'd never heard of this procedure.
The DIEP flap procedure utilizes a patient's excess abdominal skin and fat tissue and transfers that to make 1 or 2 new breasts with their own tissue, which is alive and stays with them for their entire lifetime. It does not have to be switched out as breast implants do. The tissue from the abdomen is moved on to the chest. This whole category of breast reconstruction is called autologous reconstruction, meaning from the same individual.
That's amazing.
So it's very important for me to examine you and give you my opinion as to whether we can make 1 or 2 new breasts for you utilizing your own tissue.
Thank you. I did not know this option was available, and I'm very, very excited to use my own tissue.
Good morning, how are you?
Good morning.
My name is Dr. Roth.
Hello.
I understand, unfortunately, you've been diagnosed with breast cancer.
Yes.
I'm very sorry to hear that.
Thank you. I came to Claremont Medical Center and I met Dr. Roth, and he said I was a very good candidate for the DIEP flap. It was explained to me that the DIEP flap is the most natural reconstruction, and you do it once and then you never have to have another surgery.
For a patient who's 35 or 40 and diagnosed with breast cancer, if they went the breast implant route, they could be looking at 2 or 3 potential future surgeries in their lifetime where broken implants are removed and replaced, versus the DIEP flap autologous reconstruction, which is done once and they live the rest of their lives with their own tissue that will not break.
It was a no-brainer. This was a no-brainer over having something that was silicone and that would have to be replaced, and having something that was my own tissue.
If you could imagine the excess tissue that is between a person's belly button and their underwear, instead of being discarded as it would be in a tummy tuck, a block of tissue can be very carefully dissected with its feeding nutrient artery and veins, disconnected from the body, and then reconnected to the circulatory system in the chest so that it comes back to life and has proper circulation, and it is alive and carefully sculpted to the shape of 1 or 2 breasts. That's the essence of the DIEP flap with microsurgery. The positive side effect is that the patient's abdomen is much flatter and tighter, similar to a cosmetic tummy tuck or what we call an abdominoplasty. The goal, of course, is to cure you of breast cancer. That is the absolute #1 priority. The next priority is to restore your body's form and function so that you feel like nothing ever happened, that you have 2 new natural breasts. In terms of the scarring on the breast or both breasts, it's very dependent on how much skin, if any, had to be taken by the breast cancer surgeon. If we save the nipples and we save all the breast skin and recreate their breasts with their own abdominal skin and fat, they can appear as if they never had any breast cancer surgery. In terms of the donor site is closed very elegantly as if it were a cosmetic tummy tuck.
Making the decision to have the procedure, after you got the diagnosis, you're almost numb. I've never dealt with any medical situation for myself personally. I've always been the caregiver, and I'm very comfortable in that role. So for me to switch gears was tricky for me.
In many situations, the DIEP flap procedure is performed on the very same day as the breast cancer mastectomy procedure. The surgical procedures can be an additional 6, 7, or 8 hours on top of the mastectomy surgery. So it is a big day of surgery for the patient, which is why we have to choose the patients carefully.
You do feel like you've been through something very, very major, and you have. But it's amazing how quickly your body can recover.
The recovery from the surgery was, for me, I was out of work for 6 weeks. Each day was better, but it was the first 3 weeks, I would say, were my roughest. And then by week 4, I was feeling back to myself, and by 6 weeks, I was ready for work.
The patients are kept in the hospital for 2 or 3 days. Then they're allowed to go home. They would be able to shower by 7 to 10 days after surgery. They'd be able to drive a car by approximately 2 weeks after surgery. They would return to work by 3 to 4 weeks after surgery.
Life after surgery, I wanted to get back to who I was as soon as possible. I added things gradually back in, and I think that's what made life get back to normal for me, was just going through my normal day. On the weekends, I go for walks, I take the dog. Summer's coming up, I go to my friend's pool.
I have a dog. I do like to get out. So this year I'm excited to get back to normal and have a flat stomach.
Hello, Dr. Friedman. How are you? Thank you for sending me that new patient for breast cancer reconstruction. She is strongly considering the DIEP flap, and fortunately, she's a very good candidate for it. Helping patients with breast cancer is one of the main reasons to become a plastic surgeon.
For me, this was the best decision I've ever made, and I would tell anybody that. This procedure, I truly believe, saved my life.
The peace of mind, the fact you don't have to do mammograms anymore, to know that you're clear, you're free and clear from it, that's a huge plus.
Plastic surgeons do many, many different types of things. We operate on patients of all ages and both sexes. We operate on many, many different problems from the top of the head to the bottom of the foot. But, creating 1 or 2 new breasts for a patient and restoring their body image without living with any deformities is a fantastic thing.
Cancer's a horrible diagnosis, but everything up here in the plastic surgery suite has been nothing but positive. Everything has been very convenient. I can't say enough good words about Dr. Roth, and anybody who has a diagnosis like this, I just want them to be aware that this procedure is available for them in Westchester County. You don't have to go into Manhattan for this kind of operation. You've got it right here on your doorstep with the best.